You'll be glad to know that a great news has come out of a study in India, where apparently we are now being told that the sudden deaths that were happening there, that seem to be increasing at a rate that is concerning public health, is not connected to the elephant. If you have been following my channel, you'll know exactly what I mean. I'm very cautious with what I say these days because censorship still exists. But let me explain what happened. And I'll take you through some of the points in the paper. I'll show you the news headlines. And at the end, I'm going to share with you my recent made music video. I shared it earlier, but a lot of people probably haven't seen it. So at the end, I will play this video about pulmonary hypertension as I realize this may be a way to get important points across. But let's get back to the story here. So this is what caught my attention. There was a story here. This is in India, NDTV. COVID vaccines safe, no link to young adult deaths. The AIMS study, and it was a year-long autopsy-based study conducted by AIMS in New Delhi. So what caught my attention first is autopsy, because this is something that I've been calling for a long time. We need autopsy studies to try and understand what is going on. Again, there was another article, and this is now doing the rounds. And so you have to know how to read through to see when stuff doesn't quite make sense. But anyway, here we have another headline, and agency this is. But again, COVID vaccine rumors busted as AIMS study reveals the real reason young hearts are failing. And they were talking about, again, the study in the Indian Journal of Medical Research. And the study I'm talking about here, which I'll come to, is this one, Burden of Sudden Death in Young Adults, a one-year observational study at a tertiary care center in India. So it's an important study. And as I said, they're talking about autopsies. So for me, that's pretty important. If you don't know, autopsies are the gold standard in terms of understanding what happens in terms of medicine. Now, what the final point from the article that I just showed you is a statement here that was not in the paper, but it was from a Dr. Sudhir Avari of AIMS in New Delhi, said that the study could not have come at a more crucial moment as it cuts through the fog of half-truths and unsubstantiated chatter that has wrongly tried to pin sudden deaths on COVID vaccines. The great news, I guess, is that they know what it is not. They just don't know what it is. Maybe stress, maybe climate change, maybe, I don't know, microplastics, anything but the V. I'm going to make a song about that, I'm sure, soon. Anything but the V. It wasn't me. Yeah. So this is how things are operating now. And the problem is that it may make good headlines and it may attempt to reassure the public, but is it actually grounded in science? Is it actually saying what the articles are highlighting it to say? Because we've seen a whole range of these articles. In France, 25% reduction in all-cause mortality, yet the all-cause mortality in France is above the trend. Somebody's dying, and apparently it's not the vaccinated, so it must be the unvaccinated, and that should be a public health crisis. Something is wrong. And we seem to be getting more and more of this information. And it may be related to the fact that the FDA is finally, or the CDC, trying to do the research as to what happened in terms of mortality with children. A lot of people are getting very twitchy about that. So let's jump to the paper and see exactly what it is that it was talking about. So here you have this burden of sudden death in young adults. Again, it's in New Delhi in India. And this is the summary of sudden death. Death occurring within 1 hour of symptom onset. in witness cases or within 24 hours of last being seen alive in unwitnessed cases. So it's a major public health concern because they've been seeing more of them. And this is why they were concerned to do the research. And so they collected all these cases, and I will come back to this result in a little bit, but they were excluding people who had trauma, suicide, homicide, drug abuse, and so on. They then took them through a series of investigations and then had a team look at the causes of death. So, this, as I said, was the definition. And they used three different approaches: verbal autopsy, and they looked at COVID infection and vaccination. So they got information from the deceased relatives and friends about the circumstances of death. And they looked at drug abuse, smoking, and alcohol habits. They also did a virtual autopsy. So they did a specific multi slice computed tomography CT scan. This was looking again for unusual pathology. And finally, they took tissue from all the internal organs. This is excellent. And then they put them under the microscope. And they then finally, all the cases were collectively evaluated by a multidisciplinary team, including clinicians, for the final diagnosis. Perfect. This is exactly the kind of thing that we need, because we need to know whatever the cause is, whether it's the elephant or not, it is still important. And so we need to know what is going on. There are a few important things that they said generally, and I'll come back to it at the end as to why this is important. They looked at the history of COVID illness. So they looked at the total number in the age group 19 to 45 years that had a number of 94. And that's the group I'm largely concentrating on at the moment. History of COVID illness for 4.3%. History of vaccination against COVID, 82.8%. Now, so this is relevant, and this is part of the reason why they have to try and answer the question, because people would say, well, what percentage of those who died suddenly were vaccinated? And you can see there it was 82.8%. That means that 19.2% were unvaccinated. Okay, that's a framework. Now, actually, one of the things that I didn't see in the paper is what exactly did they describe as vaccinated. Sometimes they will use the term vaccinated, but they mean in reality they had to have 2 full doses. And I'm just checking it I'm just doing a quick look to see exactly whether or not they specified what they meant with regards to vaccination status. So sometimes they will do that to mean that they had the full doses as opposed to any dose. And they didn't actually specify in this case, which is again another one of the problems that I have with when the research is done like this. But let's get back to the paper. When we look at the mean age of the people who were vaccinated, who died, mean age in the young cases was 33.6 years old. So these are relatively young people who have had sudden death, and then they had to look at the specific causes of death. And when you look in detail here, you can see that what they focused on was that within the cardiovascular system, myocardial infarction was 34 here of the cases had myocardial infarction. So 40 in total, 34 or 85% of them had a myocardial infarction as the primary cardiac cause of death. And they had a few who had an enlarged heart, hypertrophic cardiomyopathy. This one here had some tiny microscopic infarcts that we thought was congenital. There was some infective endocarditis, just 2 cases. There are a number of other cases with regards to the lungs, pulmonary system, pneumonia, asphyxia. There was gastrointestinal system, and so on. But what you have to look at here is this bit. And actually, when I look at this here, this is very important. Sudden unexplained death or negative autopsy. This is the bit that is very important. 21.3% of them had a negative unexplained death or negative autopsy. This is important. Now, in order to understand why that's important, you then have to understand what causes sudden death in a young person. And the principles are that if it's anything outside of the heart, you can usually see it on autopsy. So if somebody had, they were young and they had a massive dissection of the aorta, the CT scan would pick it up. If they had a massive brain bleed, the CT scan would pick it up. If they had a massive pulmonary embolus, the autopsy would pick that up. You'd see a big clot in the lungs, in the lung arteries on autopsy. So you're then left with cardiac causes of sudden death. Okay. Now, in order for someone who is fit and well generally to suddenly die of a cardiac related cause within an hour or overnight going to sleep, it usually points to an abnormal rhythm, an arrhythmia. And one of the problems that has been coming up is this question about fibrotic changes in the heart, microscopic microscars found by the Japanese, never been seen before. And the presumption is that these are little focal areas of myocarditis, which then become scarred and can trigger abnormal rhythms. So I've got a few slides here just to show you, to help you to understand what I think is happening here. And the details here are important for you to get in order to see why I would challenge their reassurance that there is nothing to see here. So when we look at this principle of microscarring, this is my description as to what it would look like. Now, these scars are big because they are tiny, they're microscopic. You can only see them on a microscope. But this is showing you the heart and kind of pointing out that you would have these tiny microscars that would show fibrosis in the heart. Then this is probably a better image, but again, these spots will be too big. But it's giving you the idea as to what they found in Japan. Multiple tiny little scars within all throughout the heart. And these scars can also trigger electrical rhythms. And this is then where the risk would occur with regards to abnormal rhythms. Remember, I just said that if you haven't found another cause for the death, the unexplained causes are most likely going to be an arrhythmia. And what that looks like is just again an image here. This is a normal ECG where you have the P waves, the QRS complex, and then the T waves. This is one heartbeat, so to speak. It would call one pulse. You'd feel the pulse bound once for all of this. This is where the ventricles contract. And this is normal. And what you have to understand is then what is abnormal in this picture. So the most likely rhythm is going to be what we call ventricular fibrillation. And what that would look like is something like this, where the heart is going along normally, and then suddenly it has an abnormal rhythm. And the problem with this electrical rhythm is that the heart can't pump effectively. It just literally is twitching. And this is what then causes a collapse. And if they aren't shocked out of it or come out of it on their own, the person who goes into ventricular fibrillation could then die suddenly. So, takes us back to the point of the paper. As I said, I know this is where we have to be careful with regards to what is being said. So, you have to look carefully at what the paper actually said. When they looked at sudden deaths in the young, cardiovascular system cases constituted the most common cause of death. That's the myocardial infarctions. They have found that on autopsy, the damage to the heart and the blocked blood vessels. Sudden unexplained deaths, negative autopsy, in which detailed gross and microscopic examination of all the organs did not reveal any significant pathology, was observed in 21.3%. 1 in 5 died with no clear cause. Okay? Now, let's look at where they made the extrapolation. And this is, again, an important point. I'll just highlight again here from the paper the higher incidence of young coronary artery disease related deaths observed in the present study is particularly concerning and remains under documented in the Indian context. It may be attributed to changes in work life, stress, and dietary habits. They can't say COVID because they know only 4 people had it. So it's not going to be that. So, what they have found in their mind is that they have excluded. Now, this is that, follow carefully now. Remember what the paper said. Before I show you this bit here, I'm going to show you how it works with regards to the narrative that will be in the newspapers around you. So this is why you have to look. So again, when you look at the newspaper or the articles in the news, COVID vaccine safe, no link to adult deaths. That's the AIM study. In this one, they've said COVID vaccine rumors busted as the AIM study reveals the real reason young hearts are failing. Okay, good. So this is what they have been saying. Now look carefully at what they actually said in the paper. The present study did not find any significant correlation between COVID-related history or vaccination status. Okay? This is what they have taken to mean there is no connection. Now, where are the gaps? The first big gap is, as I said, they didn't specify what they meant by vaccination. Is it 2 doses beyond 14 days, or do they mean any dose of a vaccine? Very important differentiation. 1. 2, when we look at the 20% who had unexplained deaths, they didn't specify their vaccination status. That to me is a problem because that is exactly the cohort. Your natural assumption would be that 80% of them, that 16 of them, were vaccinated and 4 weren't, because it's 80% that were vaccinated. But suppose you find that 20 of the 20 were vaccinated and none were unvaccinated, or 1 was unvaccinated. That to me would be a much stronger correlate that would make it harder to say it was not the vaccine. And they should have, I think they should have detailed that in the paper. But as you can see from what the lead researcher said, he's already defending the narrative. He's not looking objectively at it. He is saying that it's misinformation to talk about the link. So what that means to me is that he tends to be biased in his natural position. So he is trying to prove it is safe. And as a result, inadvertently may leave out critical pieces of information, because I think that in the unexplained cohort, the 20 who died for which they don't know why, and it probably was an arrhythmia. The other thing I'd have wanted was to see if they found multiple microscars on histology. Most likely it was an arrhythmia. Were they all vaccinated? Important point. And so that reassurance doesn't make sense to me. And this is where we are now, is that we are not, I don't know if we can ever get true clarity, because there are now multiple camps that you have. On one side, people who think it's all related to the vaccine, and on the other side, people who think there is no connection, and left in the middle, everybody else is silent. So we are not making any progress. All I would ask is that rather than telling me that it is fine, give me all the data. Let me look at it. Let me review it. Let me make my own judgment as to what is the outcome of the study. That's where we are at the moment. And as you can see, it is going to be a challenge going forward as to how we manage to get beyond this. So, as I promised you at the end, I will play a short music video that I created. Didn't sing it myself, just put it together. And please, in the description, tell me, in the comments, tell me what you think about it. I'd really appreciate the input, and then we will close out. So let's take a quick listen to this video here, and you can tell me what you think.
I'm breathless walking up the stairs. They say I'm fine, but I'm not there. Something shifted when the world stood still. Now my heart's pushing uphill. All the tests say I'm okay, but I know something's changed. I'm breathless, but no one knows why. Something's rising inside. Since the long goodbye, I used to run without a thought. Now I stop halfway and watch. The sky feels heavier than before, like I'm pushing through a closed door. It's not fear and it's not stress, it's the space between the breaths. I'm breathless, but no one knows why. Something's rising inside. Since the long goodbye, yeah. Invisible pressure, no warning signs, a quiet way, drawing the line. I'm breathless, still standing here, listening closer, before it's too late.
So yes, thank you all very much for watching it. I love that song. I think it's pretty nice. So yes, what I've realized is that sometimes you can use music to get points across. And this is what I realize, is that if I can use that to help people to understand some of the points, it is a really powerful tool to get some of the science in a way that people can grasp it. So thank you all for being here with me. I appreciate the company. And as usual, have a great evening. Remember to like, subscribe, share, and we'll bring you more information in the near future.
A hero, an immune adventure. Humming Heroes, your lyrical guide to the body's defenders. Now on Amazon. Check the links below.